Hello, it's Dr. Rhonda Johnson, and today is Thursday, June 24th, 2021. And today I'm going to be talking about the month of June is Men's Health Month. Now, we're going to start off talking about COVID. So according to the COVID data tracker, we've lost at least 73,000 Black lives to date to COVID-19. And more Black men have died from COVID than Black women, although I do not have an exact number. But recent published reports in peer-reviewed literature have said that Black men have the highest COVID-19 mortality rates of any group defined by race and sex. And that's up to 6 times higher than the rates among white men. And yet, due to partially to long-standing mistrust in America's predominantly white medical and healthcare systems and institutions, and in the federal and state and local government, many Black men are not getting the COVID vaccine, which can drastically prevent COVID and stop the transmission of these new, highly contagious and possible more deadly variants, such as the Delta variant. Now, what we know are health disparities are widespread for Black Americans, and they start at birth and they continue until death. African Americans in this country have centuries of struggle, from slavery, discrimination, poverty, housing, segregation, unemployment, excess exposure to environmental toxins, and the fact that during the pandemic, Black people were disproportionately among the essential workers, many who had no choice but to work on site in the pandemic and didn't have the option of working from home. But in terms of other diseases beyond COVID, Black men are also more likely to die from chronic diseases, such as cardiovascular disease, that's heart disease, diabetes, and all cancers. And their life expectancy is lower, amongst the lowest of all groups in the United States. Now, depression, in terms of mental health, is often a contributing factor to many chronic illnesses, particularly obesity, diabetes, and high blood pressure. And then there's exposure to community violence, which itself can be a risk factor for depression, and PTSD, post-traumatic stress syndrome, and suicide. And too many of our African American males are exposed to community violence and victims of homicide. So Black men's health is truly a family issue. So I want to next talk about some ways to improve. And these are general topics. I don't have any rocket science recommendations here. So here are 10 tips for Black men. And these tips apply to all men, really. Number 1, and they're not in any particular order, eat more fresh fruits and vegetables. Fresh fruits and vegetables are very high in antioxidants and fiber, which can lower your risk of certain cancers and chronic diseases. Number 2, stay physically active. If there's one thing that you can do to improve your health almost immediately, it's to start becoming active. Again, you don't have to be a marathon runner. You can take small steps. You don't have to have a gym membership. You can walk around your neighborhood or go up and down the stairs in your home. You can turn on the music and dance. You can do an exercise workout tape. There's a lot of ways you can be physically active. Number 3, avoid tobacco products. And men, I know cigar smoking is kind of in style right now, but cigars aren't healthy either, and also e-cigarettes. Number 4 is practice safety. That includes wearing seatbelts, using protective equipment on hazardous jobs. It includes using a mask and staying socially distanced if you're not vaccinated for COVID. It includes having smoke detectors at home that work, practicing safe sex, and avoiding high-risk situations for violence. Number 5, getting a COVID vaccine. Now, you know I was going to say that. And keep all of your immunizations up to date. Number 6, protect your prostate. That's by eating a low-fat diet and a diet rich in high fruits and vegetables. And know your family history of prostate cancer, which disproportionately affects black men. See a doctor regularly and talk to your doctor about either a digital prostate exam or other ways to screen for prostate cancer. Number 7, and this is controversial, but I want to share it. Watch your intake of grilled, well-done meat. I know a lot of men who consider themselves grill masters, but there's a growing body of evidence that suggests that grilling contributes towards the formation of cancer-causing chemicals. You know, when that fat and juices and that smoke generates on that grill? Well, those chemicals can, when inhaled or when you eat them, even if the meat isn't charred but just smoked, when they're processed by the body, they can cause cellular damage and damage to your DNA, which may contribute to the development of cancer. Number 8, manage your stress and know your blood pressure. Men have to know their blood pressure because it's so common in African Americans. And if you have high blood pressure, get treated for it. Number 9, get enough sleep. Sleep is how our bodies reset. They say we need between 6 to 9 hours of sleep a night. Very few of us probably get that much sleep, but we can try, right? And number 10, get regular checkups and screenings. They're important for just routine maintenance. You all know how you take your car in for a regular scheduled checkup and screening or tune-up. Well, your body needs a regular checkup and tune-up too, and it's also a way to have early detection of problems. So I started off by saying that June is Men's Health Month, but no matter when you see this video, it could be June, it could be July, it could be August, please share it with a man in your life. If he's your spouse, your boyfriend, your partner, your friend, your colleague, your brother, your dad, your grandfather, please share this video because men's health is family health. As always, my views are my own, and my only intention is to help people stay alive during this pandemic and live a safer and healthier life. Have a blessed day.